Describe the wound, the clinical examination of the injured patient. So describing the wound. The wound is a loss of continuity in the skin, mucous membranes, or in an organ. It can be caused by mechanical trauma, chemicals such as acid, which cause coagulation necrosis, or alkalis, which is coagulation necrosis, or thermal effects such as burns like combustion degree 1 to 4, or frostbite, congelation degree 1 to 3. So look at the localization, the anatomical region, the shape, the size, the type such as a graze, erosion, or abrasion, the origin. If it's surgical, it should be aseptic, and if it's traumatical, it's always contaminated. The age, whether it's fresh or it's old. If it's old, it's granulation tissue. The healing state, so is there regularly healing or is it infected? And the way, is it incised, lacerated, puncture, gunshot, or bite? So the sharp objects, the prognosis is usually good. If it's produced by a sharp object like a nail in the hoof, the prognosis depends on the presence of anaerobic infections. If it's caused by teeth, the prognosis depends on the level of tissue damage and the presence of anaerobic infections. And if it's a bullet or a gunshot wound, the bullet may wander to different tissues or may be encapsulated. And the clinical examination of the injured patient, so the emergency and stabilization of the patient off to the clinic. So check circulation, stop bleeding, prevent any further injury, and the wounds, make sure there's sterile coverage and gauze bandage. Relief and anxiety, give alpha-2 agonists such as xylazine or dotomidine. Do not give asapromazine. And the painkillers are COX-2, such as ferrocoxib. And for the clinical examination, if the heart rate is above 80 and there's poor peripheral pulse quality, the animal may be in shock. Check the respiratory rate and any signs of dyspnea, mucous membranes, capillary refill time, and check the hydration. Check the skin tuber and the eyeball position and the hematocrit. So the risks are shock, pneumothorax, internal bleedings, and examining the wound. Take a swab for microbiology before cleaning the wound, and use aseptic preparation, clipping the hairs, disinfectant, povidone, and chlorhexidine, and use wound debridement to remove any injuries or necrotic tissue, and use the lavage. This cleans the wound from debris and bacteria. Check for any foreign material. And the primary wound healing is closure, and secondary wound healing is when there's high contamination or lack of tissue or huge material loss and results in granulation tissue.